Well, it is estimated that about 2.1 million new cancer cases are diagnosed in the U.S. alone each year. And among those cases, about 18,000 are diagnosed with sarcoma, which is a rare cancer of the bones or soft tissue. Very important discussion. So joining me now to tell us all about the rare group of cancers is Dr. Daniel Lerman, an orthopedic oncologist from HealthONE Presbyterian St. Luke's. Thank you for being here. First and foremost, please let our audience know if they don't know what sarcoma is.
For sure. Well, thank you for the opportunity, because as you said, July is Sarcoma Awareness Month. So it's nice to be able to be here and increase awareness of that disease process. Sarcoma is a cancerous process that occurs in the bone and the soft tissues. It can occur in our fat cells, our nerve cells, muscle cells, and it's something that we don't think about regularly because it's not as common as other cancers that we hear about more commonly.
And is it more common in kids, younger adults? And if it is, why is that?
So sarcomas we see across the age spectrum. It is disproportionately more common in the pediatric population.
Why?
Meaning it is the most common solid tumor in kids. It is less common, relatively speaking, in adults, but still occurs frequently.
And why do you think it is more common in kids?
So cancers occur usually in rapidly dividing cells. And we think that during the time of adolescence, as we know, when people have their growth spurt, we have more bone cells that are rapidly dividing. So there's more opportunity for genetic mutations to occur and then for cancers to develop.
Okay, that makes sense. But you never want to see somebody young, be diagnosed with cancer. So I'm glad that we're talking about this. What are some of the signs or symptoms that we should be aware of?
So bone sarcomas or bone cancers are typically painful. It's pain, there's a deep, achy pain that occurs at night, usually more severe at night than during the day. So if you have pain regularly in a same spot that wakes people up from sleep, that's worth investigating.
Okay.
Soft tissue sarcomas are usually painless. They're painless lumps or masses that are growing in our body. So just because something is painless does not mean it could not be cancerous.
But would you feel the lump? Would it be something that, me as a mom would be able to see in my child?
So typically, sarcomas are in the deeper tissues of our body.
Okay.
So when they're really small, it's not usually something that you're going to feel. But people can notice masses on themselves. That's why it's important to have an awareness of your body and check in with yourself, your physical body regularly. And hey, if there's something that is asymmetrical or a new mass or new growth, even if it's painless, it's worth investigating.
Good information. What about treatment options?
So treatment options continue to expand. But sarcomas are still treated by the mainstays of surgery and sometimes chemotherapy or sometimes radiation therapy, depending upon the type or flavor of sarcoma.
Is it something that, and I know this might be difficult to state, or maybe it's not. If you were to get it, is it something that's easily treatable in comparison to other cancers or no?
So cancers represent a wide spectrum of behaviors, right? Some cancers are what we call low grade and some are high grade. Sarcomas typically fall within the high grade category, meaning they need intensive treatment. They are still very treatable, still very curable. If we catch them early, it's easier to cure. So that's why it's important to have an awareness of your body, what's going on, and catching a cancer early really saves lives.
Preventative medicine is the best medicine. If somebody's experiencing any of these symptoms or they know a loved one that is, what would be the steps that they should take right now?
So the most important thing is to just not dismiss a mass out of hand, not dismiss chronic pain out of hand. So if something is painful in a bony area, again, night pain is worrisome. If there's a mass that's enlarging, even if it's painless, it's worth investigating, typically with imaging. Our imaging nowadays, such as MRIs, are very, very detailed and can really key us in, if something is problematic or not.
That gives us a lot of hope. The fact that we're able to talk about this and spread awareness and being body aware, that alone is life-saving. And of course, like you said, if you have any pains in your bones or whatnot at night, better safe than sorry, go to your doctor. We really appreciate you, Dr. Lerman, for being here and for all that you do. Thank you.
Thank you for the opportunity.